I'm tired of watching them come in with a slight respiratory problem, knowing I could probably help them with oxygen, but I'm denying them until they, as you described it, crash. And then I put them in a coma, put them on a ventilator, and kill them. I'm sorry. None of us should be appreciating medicine when it is done like that.
That's right.
And then if it wasn't enough, all the reasons we're killing people for no reason, President Trump says, I like this drug, hydroxychloroquine. It's working in France. Hundreds of studies around the world shows that it's 99% effective against serious illness as long as it's given at the moment that you start showing symptoms. And what does Cuomo do, and what do governors do all across the country that are Democrats? They ban the use of the only treatment we know of in the world that is having success. All of this happened while we were sitting at home hiding. That's how you get to 200 deaths. That's how you take the cold and you create a pandemic all around the world. And very quickly, 200,000 deaths really isn't even that much anymore. If you compare it to the other deaths before. And the reason we can't do that is because they recategorized the way we do this. Do you realize that every one of us have had a family member die that were really sick with heart disease or cancer or COPD? And when they died, the hospital said, died of complications due to cancer, died of complications due to heart disease, died of complications due to COPD. Why? They died of pneumonia most of the time. Most of the time, they either got a flu, or they got a coronavirus, a cold, or a rhinovirus. And everyone knew you don't blame the virus. The only reason they couldn't fight off a trivial illness like a cold was because their immune systems were totally shot. In fact, a lot of times they didn't want to admit it because it was the drugs that had lowered the immune system or the chemotherapy that had lowered the immune system. So they couldn't fight off the cold. But now, this year, for the first time ever, nobody hears the line, died of complications of heart disease. They hear, died of COVID-19. As you saw, the CDC said only 6% are dying of only COVID-19, and I would like to check those numbers too to see what was really going on with those people. But 94% had at least 2.5 other comorbidities, co-deadly diseases. And though those people matter, they die every year. 640,000 people die every year from heart disease. Hundreds of thousands from cancer, diabetes, you name it. Where do you think those deaths are? And what are we calling them now? COVID-19. Okay? So even with all of the death and destruction, they can still only get to 200,000 using a bloated death system where you're not, as soon as you have or die with COVID-19, you die from COVID-19. This is a scam, people. It is the greatest lie ever told in the history of the world. But we are really lucky they decided to tell it. That's the greatest gift that I was ever going to get. Because I was slowly managing, as you could see the dots all over that board. What were we, the red dots enrolling people? Yeah, we were getting people, but not fast enough. The pharmaceutical industry was still getting away with vaccines are safe and effective. Period. And everyone was believing it. This mythological idea that this one product that pharma makes that doesn't harm anybody. Right. I mean, can you imagine if you drove by a billboard that said drugs are safe and effective? You were like, whoa, hold on, we'll put that up there. What do you mean, like every drug? What kind of lunatic would say something that stupid? You were buying it with every vaccine that was out there until they decided to make the COVID-19 vaccine. I'm not going to get into that. I've already taken you through that stuff. Let's see where we're at. Okay. This just to prove the issue with the vaccine and why it's falling apart. Remember, when we have been suing and trying to get people to understand that vaccines are actually dangerous, and in every trial they saw that they were dangerous, and you've got to stop listening to your doctor that got a half-a-day education and start listening to those of us that are investigating this. You have to know they're dangerous. A lot of people didn't want to hear it. So then something beautiful happened. This pandemic came along. I believe it was planned, but not this way. My belief is that they were planning to have a pandemic of some kind, but they were running out of time. You were moving too fast. It was getting dangerous. So they couldn't wait till a year from now or 2 years from now for an Ebola outbreak, which would have made a lot more sense. They had to do it now. And the reason I think they jumped the gun was because of the fact that they didn't have a vaccine ready to go. Think about it, folks. If you're going to pull the biggest lie and scam of all times, you need the product you're going to try and sell everybody on to be ready. But they weren't ready. They were about a year out from a vaccine, which means they jumped the gun. And that, my friends, if you watch MMA fights and you see some tiny little guy trying to go up against a giant monster, anytime you're trying to beat Goliath, you need Goliath to make one mistake. And you have to be ready for that mistake, because it's all you're ever going to get. And here is their mistake.
We partnered with a group at the New York Blood Center and the Galveston National Laboratory to take on the big scientific challenge of coronavirus vaccines. And I say a scientific challenge because one of the things that we're not hearing a lot about is the unique potential safety problem of coronavirus vaccines. This was first found in the early 1960s with respiratory syncytial virus vaccines in children, and it was done here in Washington with the NIH and Children's National Medical Center, that some of those kids who got the vaccine actually did worse, and I believe there were 2 deaths in a consequence of that study. Because what happens with certain types of respiratory virus vaccines, you get immunized, and then when you get actually exposed to the virus, you get this kind of paradoxical immune enhancement phenomenon. And we don't entirely understand the basis of it, but we recognize that it's a real problem for certain respiratory virus vaccines. That killed the RSV program for decades. Now the Gates Foundation is taking it up again. But when we started developing coronavirus vaccines, and our colleagues, we noticed in laboratory animals that they started to show some of the same immune pathology that resembled what had happened 50 years earlier. So we said, oh my God, this is going to be problematic. These clinical trials are not going to go quickly because of that immune enhancement. It's going to take time. So, and unfortunately, some of my colleagues in the biotech industry are making these inflated claims. You've seen this on the newspapers, we're going to have this vaccine in weeks, or in this and that. What they're really saying is they can move a vaccine into clinical trials, but this will not go quickly, because as we start vaccinating human volunteers, especially in areas where we have community transmission, we're going to have to proceed very slowly, very cautiously. The FDA is on top of that. They have a great team in place at the Center for Biologics Evaluation Research. They're aware of the problem, but it's not going to go quickly. We are going to have to follow this very slowly, cautiously, to make certain we're not seeing that immune enhancement. So now we're hearing projections a year, 18 months, who knows?
All right. Peter Hotez hates my guts. Just let's have that on the record. Very, very outwardly has stated many times how much he dislikes the work that I do. So has Paul Offit, a vaccine maker. But he and Paul Offit joined 400 doctors to sign a letter to Donald Trump saying, slow this vaccine program down immediately. Why? Why are pro-vaccine doctors suddenly terrified? Because they made the biggest mistake of their lives. The WHO, Bill Gates. He decided, let's try to tell everyone the vaccine is their only way out, and we're going to do something we've never done before. We're going to let the world watch as we try to make the sausage. That's what's going on. And this doctor right here, and everyone likes him, knows this is going to devastate our vaccine program, you morons. This vaccine is going to kill people. It is going to make people sick. We know it for a fact because of every trial we've done. And you idiots are making the world wait, lock themselves down, destroy their economies, waiting for a vaccine that is a complete and total failure and always has been. What are you thinking? Well, I'll tell you what, we were all over this, which led to headlines like this: anti-vaccine movement could undermine efforts to end coronavirus pandemic. Researchers warn, you're darn right. But guess what? Suddenly, as we started saying the world, the New York Times kept calling me, and Washington Post saying, Bigtree, you're the king of the anti-vaxxers. Like, well, I don't know if that term actually fits, but whatever, what do you want to know? Are you going to get a coronavirus vaccine? I literally had one reporter say, I said, well, no, of course not. It hasn't gotten to safety trials. She's like, well, I'm already committing my family. We're going to get the coronavirus vaccine as soon as it's ready. I was like, wow, it's interesting. Have you looked at the science? I mean, do you ever read science? Don't you care as a science reporter to actually look at what that vaccine is? Do you know that 20 years that it's destroyed animals? Are you actually signing your family up to die for a vaccine? It's like, well, I hadn't really thought about it like that. No, clearly. Clearly you haven't been thinking this through.
Amazing.
But lucky for us, our message got out. And though New York Times kept saying, crazy Del Bigtree anti-vaxxer, not so sure about the coronavirus vaccine, it was really awesome to watch CNN and everybody else join in when this happened.
Breaking news on a possible COVID vaccine. Testing has been paused on hold worldwide.
Drug maker AstraZeneca is halting its phase 3 trial of a possible COVID-19 vaccine after one participant came down with an unexplained illness.
Healthy volunteer walked in healthy, now has a significant problem. They've got to investigate that.
It's not exactly known what happened to the patient or if it's even linked to the vaccine.
This is the first report of a serious safety issue for a vaccine that is in late-stage trials.
We don't have a sense from AstraZeneca how long this pause will last, how much of a concern it is for them.
The person who has the adverse effect, they need to see if this person recovers.
There's so many questions about what this event is, whether it was caused by the vaccine, and what impact it'll have on this trial and potentially other trials. Right now, those are all question marks.
And this just underscores the importance of widespread human testing in phase 3 trials before any vaccine goes to market.
And safe and effective comes crashing to the ground. It's over. It's over. Never again in the world will anyone ever get away with saying, trust it, it's just safe and effective. It may sound like one vaccine at one time in one moment, but all we needed was that door to crack open. I can kick it in.
All right.
Now, all of this has led to serious issues, right? I mean, everything that has been predicted at Red Pill is now happening. You're watching the dollar disappear. We're watching electronic currencies taking over. Discussions of microchipping, tracking. They're looking at how close we're standing together with our cell phones. Eventually they can make it illegal to kiss or hug. There's even discussions now about maybe having you wear masks inside of your house. But remember, at the beginning of this, they thought they had it, right? 7 in 10 Americans would be likely to get a coronavirus vaccine. This is June. Oh, we got it. We're going to get the world, man. We got 70% who are already with us. They love this vaccine idea. Go ahead, make that sausage. It's all going to be okay. But then, in August, here's where we're at. 2/3 of Americans say they won't get COVID-19 vaccine. Now, of course, this is what's happened to me because of it. Facebook and YouTube are letting anti-vaccine figure Del Bigtree push deadly coronavirus misinformation. Pretty soon they'll be listing me as a terrorist. This was all the week that frontline doctors came forward, right? This is the weekend before I was being attacked by Media Matters. And then we watched the frontline doctors step in front of the Supreme Court and talk about the success of hydroxychloroquine, the fact that this pandemic should be over, and doctors with real licenses said, let's send our children back to school. 18 million views they had in 6 hours before YouTube, Facebook, Twitter all took it down. And then the website, the platform they used to build their website was taken down. 2 days later, my YouTube channel was taken down. Are we under attack? Sure we are. Why are they attacking? Because we're kicking their ass, that's why. As soon as YouTube cut our channel, we had 1 day to put up our show, The Highwire. TheHighwire.com, our player was YouTube. We used the YouTube channel in order to have a player. So I hired a company, said, can you give me a player overnight as fast as you can? Well, the next day we were up, we did the show, and our site crashed down. And I thought, my God, we usually get about 5,000 to 8,000 live viewers with YouTube during a show. They must have all come at one time, like all 10,000. 2 days later, we got our analytics. 250,000 people tried to watch The Highwire. YouTube's been lying to us.
How funny.
This is what it's about tracking. The WHO had a plan to have an ID for every single person on the planet, to track each individual's immunization status, leveraging immunization registry's electronic database and national identification number. This was what it is in the works. They tried it in Argentina. In Argentina, you can't get your driver's license or a passport until you have all of your adult vaccines. I said this last year, I just want to get it through. This is what we're up against. This is why the tracking. Here's the EU's passport, supposed to be by 2022, have all of your medical information on it. That was ours. Health and Human Services saying the same thing. Let's go ahead and play this video because I don't remember what it is. Oh, this is great. This is out of Australia. This is just the other day.
A home situation, and we'll give more detail about that in due course, but it is both a safe place and a dangerous place. We must treat this new world order, this new world of COVID, we must treat it with a high level of care and caution.
Oh! You know what I was saying? Don't say the world order. Don't say the world order. Don't say the world order. New world order. God! Oh my God! Mikey! It came right out my mouth! It's a new world order, right? The great reset is upon us. We've got to make sure that this reset sets us back to the natural world. That includes being divine beings of God. Not computer simulations of ourselves. And it's getting really serious. It's on, okay? Remember in the movie, there's the one character that wants to take the blue pill and wants to go back? Yeah. There may be those of you among us. But all around the world right now, millions showing up in Berlin. Tens and hundreds of thousands in the UK. We just had several hundred in Austin, thousands of different, rallies around this country, but we've got to stand up. But people have had it. More and more know the truth. And what happens when that happens? The battle begins. This is on. If you have children in the room, you may want to just hide their eyes for a second, because I think it's important to see what's happening to the freedom fighters that are standing up around the world right now.
You should be ashamed of yourself. You should be ashamed.
This has to happen. This has to happen. They have gone we are waking up because of it. But are we going to let our brothers and sisters do this alone?
No.
We're going to sit on our bark loungers and say, I hope someone figures this out. This moment is ours. This moment is why each one of you is here. There was always going to be one issue that was the Achilles heel. One issue. Maybe only one mistake. And we are ready for this. Now.
Yep.
And because of this ridiculous oppression, you've seen the mother dragged out of the football game watching her kid and tased in America. This is happening. And it has to happen to find out if we are still awake. Are we still here? Are we still free? Our founding fathers told us these questions would be asked. We're not alone. Doctors and scientists, virologists, epidemiologists, all around the world are stepping up right now. And they're stepping forward. And some of them are now in the White House of the United States of America. All over 0.25% illness. This is an amazing moment that happened just last week.
Alternative strategy for dealing with the current crisis, and that strategy essentially consists of shielding the vulnerable, those in care homes, obviously, and stopping infections in hospitals, but also more generally in the community. We think we can do that while allowing those who are not vulnerable to this disease to go out there and get infected and build up what we call, and will continue to call, herd immunity, which is a level of immunity in the population that reduces the risk for everybody. Many of us, quite independently, have come up with or have been thinking in various different ways, but this has not been given a wide reception. I, in fact, met with resistance.
Dr. Gupta just mentioned herd immunity. She came right out with it. That's the phrase that people are very anxious to avoid using. I mean, even the Swedes say that that's not their strategy, that just is a possible byproduct. Are you advocating a herd immunity strategy?
So herd immunity is not a strategy. Herd immunity is a fact about most infectious diseases, the course that they spread through the population. Even if we were to have an effective vaccine, we would be relying on herd immunity as the endpoint of this infectious disease epidemic. So it's less of a strategy than a recognition of a biological fact.
If we do nothing, then we're going to have some old and some young people getting infected, and we'll have a lot of death. If we protect everybody equally, then we can have some, eventually, it will take longer time, we're sort of stretching it out, but eventually we can have some old people and some young people getting infected, so we'll have many deaths. So the overall strategy is to protect the elderly while letting the young live their lives.
Can I ask you, how does this interplay with politics? We are literally in the middle of a presidential election, and the president is in hospital with the disease.
I think in the context of an epidemic that has touched every human on the face of the earth, it's inevitable that it will be political. I don't actually know the politics of my colleagues. I'm pretty sure that if we did, we'd probably disagree. What's striking to me is that despite this diverse background, we've come to an agreement about what the science is telling us. This is a science-based approach, and it's aimed at minimizing the harm to the population at large. And I think that's the message we want to send.
These three world-renowned scientists met with Alex Azar last week. He tweeted out, I just met with this. Dr. Scott Atlas has been in the White House saying exactly this. Our country is now looking at the right way to do this. Now, I'm not going to get political. All I can say is what I know as a reporter. All I can say is what is being said, who's doing what. We're being told that our only way forward is to lock ourselves down longer, to wear masks longer, meaning the air you breathe is illegal. It is illegal to breathe the air on this earth created by God. We cannot have that happen. And now, scientists around the world are joining this cause. Why? Think about what's happened. They have lowered the death rate to 0.25%. 0.25% is worthy of locking down our nations, locking us in our houses. Now, you may want to argue whether or not 0.25% is a lot of death, but let me tell you this. If everybody that dies with the disease has the disease, then the flu kills hundreds of thousands of people every year. A rhinovirus kills hundreds of thousands every year. Every infectious disease on this planet, essentially, is capable of 0.25% death rate. If, when you die with it, you die from it. Meaning, we are never going to open up. We are never going to take off our masks. That is what we are all about to vote for. That is what we are all a part of. Are you going to be locked in your prison? Are you going to be like Australia, where you're only allowed a half a mile from your house, or you're arrested? These are the concepts that they are discussing right now. Somehow, Ed Griffin knew when he brought Del Bigtree here 2 years ago, this was going to get real. And it is. So these doctors, I'm going to give you a call to action right now. Tens of thousands of doctors and scientists have now signed this declaration by those 3 doctors, the Great Barrington Declaration. Look it up online. Even civilians are allowed to sign on to it. We, by the millions, need to sign on. And what it essentially says is we want the world to transition into a new approach. The old approach. The one we've used since the dawn of man, which is, let's protect our elderly and sick, keep them safe if they want to be. If they want to take their risk and come out, great, that's up to them. But the rest of us that are healthy enough, that have a less than 0 chance of dying from this illness, and our kids that have no chance at all of dying, get their masks off. Let's get out there and catch this cold to save the world, to save our freedom. I've watched one brave individual actually represent this idea. Someone that I've watched wear a mask less than anyone else I know. You all know who it is. And this is how he is telling us to proceed. Well, sorry. Oh man, I can kill in a moment.
I just left Walter Reed Medical Center, and it's really something very special. The doctors, the nurses, the first responders, and I learned so much about coronavirus. And one thing that's for certain, don't let it dominate you. Don't be afraid of it. You're going to beat it. We have the best medical equipment, we have the best medicines, all developed recently. And you're going to beat it. I didn't feel so good. And 2 days ago, I could have left 2 days ago. 2 days ago, I felt great, like better than I have in a long time. I said just recently, better than 20 years ago. Don't let it dominate. Don't let it take over your lives. Don't let that happen. We're the greatest country in the world. We're going back to work. We're going to be out front. As your leader, I had to do that. I knew there's danger to it, but I had to do it. I stood out front. I led. Nobody that's a leader would not do what I did. And I know there's a risk, there's a danger, but that's okay. And now I'm better, and maybe I'm immune. I don't know. But don't let it dominate your lives. Get out there. Be careful. We have the best medicines in the world, and they're all happening very shortly, and they're all getting approved, and the vaccines are coming momentarily. Thank you very much, and Walter Reed, what a group of people. Thank you very much.
Now, I know a lot of us have a lot of questions, but I want to ask you this. What is the opposite of that perspective? What does that world look like? What does the opposite of that perspective look like? I'm not saying he's got it all right. I'm not telling you how to vote. All I'm asking you is, what is the opposite of the idea that we don't let invisible enemies control us? Same statement made after 9/11. when we were attacked by terrorists. We cannot let this change our way of life. We cannot give our freedoms up because of some elusive enemy. We are the United States of America, and right now, China is back to work. China is fully manufacturing